My name is Eric Naumburg. I'm a pediatrician, now retired, and working for single payer in the state of Maryland. To address Liz's question, the Affordable Care Act has two main flaws. The first is that it will not cover everybody. Right now, the Congressional Budget Office is saying that it will leave 26 or 27 million people uninsured, which is about half of the number that's uninsured right now. And the other big problem with it is that there's no real good cost controls in it. It builds on what is a broken system, which is the private insurance system. The individual mandate to buy insurance, which is being argued now, is really in effect amounts to a giveaway to the private insurance companies. And as many people know, the private insurance companies' main focus is making money. It is not providing health care. Currently, our healthcare system is extremely inefficient. The average cost per person in the United States is about $8,400 per person for health care, which is on average more than twice as much as other wealthy countries spend on health care. And the big reason for that is administrative costs. The total administrative costs in the United States run around 33%. Just for a comparison, Canada, which has a single payer system, runs about half that in administrative expenses. And where do the administrative expenses come from? Well, they come from insurance company administration, profits, executive salaries, but that's only part of it. The bigger parts are the huge office staffs that hospitals need to, or administrative staffs that hospitals need to hire to deal with all these insurers. And also in private offices, most people who go to a private doctor now will see 5, 6, 7, 10 people sitting behind the desk, and most of what they're doing is talking to health insurers. So what it's going to do is create what we call the unaffordable uninsured, which means that people will be forced to be buying policies that will be covering about 60% of their healthcare costs, because those will be the cheapest policies. People in the exchanges. I haven't talked about what the exchanges is, but that's the bill forces people to buy private insurance through exchanges. Those who aren't covered by their employers, or through other groups, or by federal programs. And we're afraid that those policies are not going to be affordable for people, especially once you get sick. So there are lots of other problems. For example, more than half of bankruptcies are now caused by medical bills, and this bill is not going to change that at all. May make it worse. That's from the experience in Massachusetts, which has a similar bill. It's a step in one way. It's a step forward. In another way, it's a step back, because eventually it will be unaffordable, which is what they're beginning to find out in Massachusetts, where they passed very similar legislation.
So we'll see where it all goes with the courts.
Yeah.
But thanks for explaining all that. Why do you think a single payer would be the best choice for our state of Maryland?
Okay. Well, we have about 750,000 to 800,000 people who are uninsured in Maryland. From studies, we know that not having insurance is a major health risk, because people put off care. And there have been a couple of national studies done that say that for every 1,000 people who are uninsured, one person will die each year because they could not access health care. And what happens is people put off care because they can't afford it, and then they wait till they're very sick, and then that's when they show up at the emergency room. And so in Maryland, that would translate to about 750 people. That's about 15% of the population that's uninsured. And Maryland is not Maryland's a wealthy state. but it's not a particularly generous state when it comes to the number of uninsured. Single payer, again, we just did our group, Physicians for National Healthcare, the local Maryland chapter, we financed a study done by a professor at UMass Amherst. His name is Dr. Gerald Friedman. And what that study showed was that you could save, by switching to single payer, about 25% of the current healthcare costs that are in the system. It was 24.4. To cover everybody at a good level, so you would have universal coverage, everybody in, nobody out, with a good level of benefits that would not only include hospitalization, doctor visits, all the things you think of as medically necessary, but would also include pharmacy, dental, and vision, which a lot of people do not get. We could do that and still save money, save about $6 billion total spending. That would be in 2013. That is without the implementation of the Affordable Care Act. The savings get greater because will be greater once the Affordable Care Act is instituted, because the Affordable Care Act will actually increase spending in the state. So the message is we could cover everybody in a system that's very much like Medicare. You would pay a tax that would replace your premium. Most people would see their incomes go up, not down. About over 90% of people would see their incomes go up based on the tax structure we created, which was based on income. And costs go down, and it takes away a tremendous amount of anxiety that people go through trying to access health care. I mean, sometimes people getting sick, sometimes the worst part is not the actual illness, it's having to deal with the insurance companies to try and get your bills paid.
And we see it. We're doing the interviews at Healthcare for the Homeless, and when you walk through the door, you can see the number of people that need medical care but can't afford it. As a doctor yourself, retired physician, what advantages would a single-payer system offer healthcare professionals?
Yeah. Well, just let me start by saying that the idea of a single-payer government-run system is getting increasingly popular among doctors. The most recent poll I'm aware of is actually about 4 years old now, and in that poll, 59% of doctors said that they favored a nationally run healthcare system, not necessarily single payer, but a nationally run healthcare system. And the big advantage to doctors is that it takes the insurance company out of the relationship with patients. You no longer would have to think about, can this person pay for this procedure? Will this procedure be performed? You can just think about what you were trained to do, which is what's the best decision for this person, and decisions will be made between doctors and patients and not based on undertrained insurance company administrators who don't know very much about healthcare and who are making decisions based on money. The other thing it would do is to simplify physicians' lives. Over 10% of physicians' time right now is spent dealing with the private insurance system. People are getting frustrated. The other piece of this is, it doesn't relate exactly to the question, but it sort of does, which is that we have a skewing of delivery now where more and more doctors are becoming specialists because of the way the private insurers have set up the reimbursement, so that primary care physicians, internists, pediatricians, family practitioners, what people consider their family doc, the first person they would normally see, are not getting paid well enough to stay in practice. And people are leaving in droves, really. I mean, a lot of people have left practice. Personally, I left pediatrics because of frustration with the system, and I know many others who have done similarly. So, and that's why people are having a hard time finding doctors, because it's frustrating. The other thing is that once you eliminate all this office staff, people in private practice which is what would happen under single payer. People in private practice, their incomes, doctors' incomes would go up because their overhead would go way down.